Yeah, yeah. And how would you say, like, if somebody's thinking of using wearable cameras, do you think with kind of your advice and with your protocol that you were able to pass the um, ethical approval? So
Mhm.
do you think would you recommend other researchers to do with this method?
Absolutely. I'm a big fan of using this type of measurement to measure not just only screen exposure, but a number of other behaviors. But I think it's important we need to consult with people. The formative part of this work is probably more important than any other element of the work. You know, we need to understand what are the concerns. How do we overcome such concerns if they come about? So I think we need to talk to people and different types of people. Particularly if we're using them in free living conditions, we need to talk to parents. We need to talk to siblings, teachers. You know, we really need to understand what are the challenges from their perspectives. As a researcher, we often go into these studies thinking, it'd be fine. You know, we can usually get away with this, or it will work out. But the reality of using wearable cameras in free living conditions is very challenging. It's very different to what we might assume. So I think the best advice I can give anyone who is thinking about using wearable cameras in this setting is to simply talk to people, do a formative protocol to really understand what's going on and what the concerns might be. But I do believe that these images provide us with great information in terms of really understanding what's going on with regards to screen use. It provides us with a whole new element and dimension of screen use.
Yeah. So we can then move to the findings of this study. What were the main findings?
Yeah, so of 75,000 images, we found that over 70% of those involved screen activity. So a lot of images, a lot of time was spent using screens over the course of 4 days. We also found that approximately 16% of those images involved multi-screening. So it kind of it ascertained a lot of the stuff we found in the interview studies that multi-screening was happening. But we got a little bit more information in terms of what were the combinations of screens. And often smartphones would be engaged with TVs. This is the highest percentage of images that we found. We had a lot of occurrences of smartphone and TV use at the same time. So it really provided us good information around on that in terms of ascertaining study 3, the interview-based study. But it provided us some information about the context as well. We found that the majority of screen use was engaged in the home environment. Again, we need to take into account that we didn't measure screen time in schools, but we did look at home environment and outside of that home environment after that school period, and of course a full weekend day as well. So approximately, there was about 89% of images in the home environment. And when we looked at, where in the home, we found that a lot of the screen use was engaged in the bedroom environment. Again, so it would often retreat alone in isolation. Adolescents would be alone, engaging in their smartphones and mobile touchscreen devices. So again, it's ascertained the study from before, but it provided us more of a direct kind of function of learning about what was going on. We also learned about some of the social interactions. And interestingly, we didn't find too many in-person social interactions whilst adolescents were using screens. So, for example, as I've said, adolescents would often retreat to the bedroom on their own. But this is one of the limitations of the cameras. We've got a first-person point of view, but we can't see what's happening potentially on their heads. Are they wearing a headset? Are they engaging with their friends online? So lots of video gaming occurred, particularly among boys, but we couldn't quite understand or tell if they were engaging with friends through another form of engagement. And this is something that we actually we discussed in the paper that, okay, there wasn't much in-person interaction, but it's very likely that many online interactions were occurring through video game use as well. So that was one of the key findings. And we also looked at some of the temporal patternings as well. So we looked at on a weekday, when was screen use occurring, particularly based on what type of device as well. We found that laptop use was very prevalent in the immediate after school period, most likely to engage in homework tasks. We found that TV use was often engaged in the middle evening sector. And then smartphone use was very prevalent in the pre-bedtime hours. So this was, again, very important in terms of informing when do we need to intervene? When do we need to intervene with particular devices? On the weekend day, there was a very different structure in terms of the temporal patterning of different devices, and it was very, very varied. Smartphones fluctuated throughout the day. It would often be lots big use, and then an hour later, maybe it would dip, but up again, and it was very, very fluctuant in that sense. So very difficult to probably engage with a screen time intervention on the weekend day because it's very different. It's very, very variable in terms of their temporal pattern and such use. So again, we need to look at this. We need to think about, okay, if we are going to intervene, when are we going to intervene? And if we do intervene at that time, what devices are most prevalent during those times? And these wearable cameras provide us with that data.
So you said that 70% of the images included a screen. How much did you estimate that is the screen use as percentage or with per hours? I don't know. How did you define the time?
Yeah, good question. So we what we had is that every image would be we assumed it was for 10 seconds because the epoch was 10 seconds. So we were able to kind of calculate roughly kind of the average screen use that was occurring. But of course, we assume, but we can't be so sure in terms of how much screen use was happening because smartphones is a good example. We might have got an image of a smartphone when they were simply just picking up, checking notification, and then popping it down. So whilst we could kind of estimate rough calculations or estimations of time, it was more of a study about understanding the context, understanding what was going on in the environment at the time, as opposed to the duration and the time of screens.
Yeah, so cannot really determine what's the bias of the questionnaire, so other methods with this one.
Yeah, that's it. And, we could use smaller epochs. We could even use video footage, but we need to take into account some of the mechanical issues that come alongside that. The battery capacity we need to consider. We need to consider the ethical standpoint. Do adolescents and parents or other people want video footage, or did the fact that we were only taking pictures every 10 seconds provide them a little bit more comfort, a little bit more privacy comfort? So, we need to account for this. We can't just assume that that's the way to do it. We need to ask people to think about, well, is that okay? Can we do that?
So what would you say are the practical applications? Like if we know now how the weekday pattern goes between different devices, would you intervene? Do you see that there's a reason to intervene? What would be the practical applications?
Well, first and foremost, I think we need to come away from screen duration. I think we need to come away from the idea that all screens are bad and all screen use and screen time is bad. We need to think about more what's actually happening. So when we talk about intervening, we often think about, well, we need to intervene in terms of reducing time spent on screen. But actually, maybe we need to look at it in terms of, well, what's happening? If it's a certain type of screen use that potentially is not as good for us, then we can intervene and we can look at reducing that time. But what about other types of screen use? And this is something which hasn't been able to be really looked at in the past because it's ever a changing. We have new devices, we have new uses of devices now. So I think in terms of an intervention, we need to really consider how we do it and look at the nuances of screen use in younger people. We need to understand more about the functions it's serving before we intervene. So really it's about understanding first and foremost before we step in and say, okay, this needs to be influenced, this needs to be managed, because I'm not convinced we know enough at this stage in terms of actually understanding what's going on. And until we really understand of what's going on in the environment around that behavior, it's very difficult to say, well, this needs to change or the time on this device needs to change. We need to understand first and foremost through better measurement, through more direct measurement, what's actually happening. Can we understand what's going on?
And how would you classify if we start to think that what is a good use and what is bad use? So basically you can think that if you are watching silly videos, for example, it takes away time from something else, being social or learning something useful. Then there's the aspect of not doing physical activity, being too sedentary, maybe for excessive durations. How would you classify different things that we can kind of categorize, maybe bad or good or less good and more good?
Yeah, that's a great question. And I often have these chats a lot in terms of, what is good, what is bad. And if we look in the past, typically we would have a conventional TV set in the living room, we'd be sat down and it would mostly be passive engagement. These days, I mean, if you look at what we're doing right now, we're engaging, we're communicating, we're cognitively engaged. Yes, I'm sat down, so from a physical standpoint, I'm sedentary, but we're cognitively engaged. We're actually activating other elements of our bodily system. So are we doing right now? Is it bad? Is it good? Or is it a little bit in between? And I think this is key. We need to not necessarily look at things as good or bad, very black and white thinking. Well, what are we actually taking away from the fact that, we are sedentary, but there are potential benefits that are happening. And I think this is the case for a number of different screen use. If you look at video gaming, typically we're sedentary. But what's actually happening for them? They're socially connected with their friends. They're engaging with their friends. They're cognitively engaged. So it's not as simple as just simply sat down and watching passive screen time anymore. We need to consider other elements and other functions of screen use, particularly now that there are more and more devices than we've ever had, more and more digital content than we've ever had. So in terms of classifying whether it's good or bad, my answer is simply it's complex, and we need to understand more about what's going on.
So what do you think, what kind of studies we would need that we can do this better?
Well, first and foremost, I think we need to use better measurement of the behavior. And that's not necessarily just simply through wearable cameras alone. It might be through other observational techniques. And it doesn't discount the use of questionnaires or surveys or time use diaries. But I think we need to have a more of an integrated approach, not just rely on simply one method of measurement. We need to consider other types of measurement that provides us with more information, not just simply about the time. So that'd be my first point of call, is to improve the measurement of screen exposure. One that accounts for a number of different parts of screen use, not just the time. I think we need to talk more. I think we need to understand the perspectives, not just from the children and adolescents themselves, but from the team around the child, who are consistently engaged with the child during screen use. We need to think about parents. We need to think about care providers, educational providers. We need to talk to more and more people about what their perspectives are, but what are the solutions? What do they perceive to be the solutions? Again, as researchers, we often think that we can find the golden key, but actually there's probably a number of golden keys that we need to consider. And we can only find that out if we talk to people, we talk to the right people. So I think that's an important area of research. We need to ask the question, what is the problem? Is it a problem? And if it is a problem, well, what can we do from your perspective? And I think we can sometimes rely too much on what we think or what we assume and what we hypothesize, but we're not going to know unless we actually ask the people themselves. So I think this is key. I think you've got a qualitative element, but you've got a measurement element to it as well.
How is it just an idea to my mind, like these are smart devices, so they can kind of track themselves. Is there any apps which you could use in research that is actually like seeing that when is actually somebody typing, when is somebody watching a video, so it would just annotate the file and you wouldn't need to do the hard work of going through the images? And then, for example, if you'd combine it with the, for example, 5-1 accelerometry or something, you would actually get the context of posture and then you would get from the device. Have you seen any studies like this?
Yeah, so it's a great idea, and it's something which I've seen happen. The challenge with this technique is that we are limiting ourselves to devices that only have smart on them, or have a smart application on them. So, mobile touchscreen devices typically will, but then we're not necessarily looking into TV use, video game use. So we are very limited in terms of that information is great, but it's only great for particular devices. So that's where the use of more of an integrated approach, where we have another device or another type of measurement that might be able to capture the full spectrum of what's going on, as opposed to just simply relying on this app or smart device. But I think it's a great and potentially very innovative method of capturing what's going on, and particularly the content of what's being viewed on these devices. But I don't think we should be relying on that method alone. We need to be considering a number of measurement techniques, that one that has the balance right, one that doesn't necessarily burden the participant, but provide us with the most accurate information we possibly can get.
Yeah, I haven't had a TV in 10, 15 years, so I don't know, but aren't they also smart? And also the consoles, you kind of log into them, right? Or
Yeah, so in certain cases they might be smart, but whether they can track what's going on is another matter. So in the past, from in terms of a TV standpoint, studies have often had a digital recorder on the TV, which you would click to say you're in the room, you're watching TV, and then you click it off when you're done. So there's a few different ways you can do it. But it's difficult. It's challenging because there's so many devices. It's difficult to capture the full spectrum through one measurement protocol alone, and not just simply just the device, but it's very difficult in terms of capturing or the context. Are they socially engaged, not just through in person but online? How do we capture that? So there's a number of things we need to consider, and it's not easy. But the more that we actually start thinking about using a more integrated approach of measurement, I think the closer we're getting to understanding what's really going on, what is the reality of modern screen use. Yeah.
So interesting studies to be done. If we move to the recommendations at the moment in sedentary behavior and physical activity recommendations for children, you have guidelines for the screen use. Do you see them being correct? Would you like to see any changes made to those?
Okay, so short answer, yes. But I think it's very complex. And I think this is where the conversation around translation of evidence comes in. So the evidence is starting to suggest that it's more complex than just simply putting a time frame on the amount of use children should be having per day, or how much screen time they should be having per day. But in terms of how we communicate that to the general public is a whole new issue. So in an ideal world, we'd have a guideline which provides a lot more nuanced perspective on screen use. It would provide us in terms of, okay, well, what type of use might be good, what type of use might not be so good. But in terms of actually communicating this and making this understandable to the general public is quite difficult. Simply having a document, are they actually going to understand that? Are they going to read that? How can we actually project this information in a way which is not only accessible but understandable? So yes, I think guidelines do need to change from a simply duration standpoint into more contextual. And of course, newer guidelines are starting to consider this, which is great to see. But it needs to be understandable. It needs to be simple, which is difficult because it is so nuanced. The area is so complex that it can't just be a one or a two sentence guideline. It needs to be more. But maybe we can change about how we actually provide that guidance. Maybe that's the issue here. Maybe we need to think about, okay, just providing a government document isn't enough. We need to think about more innovative ways that are accessible to more people, whether that's through social media, whether that's through other platforms. It's something which needs to be looked into. The translation of evidence is so interesting because, we don't simply just have a simple solution to this screen use. It's so complex. So it needs to change.
Yeah. And now the screen use recommendations are part of sedentary behavior and physical activity recommendations, but there's many psychological effects. There's many different kind of developmental effects on screen use. Do you think there should be a specific guidelines which are not part of physical activity guidelines for screen use?
Yeah, it's a great idea. I think there's more emerging research which is coming out from screen use, particularly just screen use. And I think we need to look at what's being viewed. I think in terms of just looking at the association between the device and mental health indicators isn't enough. We need to look at, okay, well, what's actually happening? Yes, they are using a smartphone, but what is it that's causing an association between certain mental health indicators? What effect is it having on them? And I think we can only do that through better measurement, through what content is being viewed. There's been a lot of research into video game use and mental health because we can look at what the type of video game use is. But maybe we need to look a bit deeper into other types of devices and smartphone use, TV programming, social media use is a big one coming through in terms of mental health indicators. So I think it's maybe a bit too early to say whether there needs to be a separate guideline from physical activity, but I think it has scope, and I think there's potential research that needs to be clearer in this space, in the sense of, is there a mental health impact on children and adolescents? And we can only do this if we get the measurement right. And I keep coming back to this, but it's true. We need to get the measurement right. We need to understand, yes, they're using a particular device, but that doesn't necessarily give us the full picture. What are they doing on that device? What's the function it's serving them? How are they using that device? And when we get that information and we start pairing it with some mental health indicators, that's when we can be more confident about if there's an impact or not. So I think the formative stuff is important first.
And you said that the recommendations need to be really simple, but then I'm thinking also that parents are reading books about many things, how to do parenting. Like, do you think there should be? It's a really big part of children's and adolescents' life, the screen use. Should there be a book explaining different contexts, like how do you do parenting in relation to this?
Yeah, it's great. It's a great question. I think there's no one solution. There isn't just a book's not going to do it alone. A guideline government documentation isn't going to do it alone. We need to think about how parents access information. What do they go to? What's their information outlet? Is it social media? Is it through more informative guidelines? Is it through books? Is it through more infographics, visual content? We need to understand that. And we need to figure out, okay, well, my kind of impression that it will be a number of things. No parent is the same and they will access information differently. So we need to be creative in terms of how we translate the evidence, how we translate guidelines. And simply, we just said we don't know at this stage. And where we're figuring out and where we're learning that it's so complex, we're yet to reach the part where we start thinking about, okay, it's complex, but how do we start translating the evidence? So that's where I think talking to people, that when I talked before about what needs to be done going forward, I think we just simply need to talk to people, not just ask them about the screen use, but how would you prefer that information gets to you? How do you access information? We look at influencers on social media, and you think about how much audience they have, the numbers, the followers, and potentially we need to look at these avenues as well. And it's a little bit off the cuff and it's a little bit off the wall, but maybe they could be beneficial. Maybe they might actually be able to help us in terms of getting that evidence across in a way which they can. And it's a bit of a minefield, but it's something which we need to look at.
Yeah, I think that's good, because I think in at least in Finland they were using influencers in the beginning of the COVID pandemic to promote the kind of the knowledge of COVID and how to protect against it. So I don't see why they couldn't do it with the screen use. Also.
Yeah, absolutely. Yeah. But it's understanding first and foremost why parents or why other people might go to that platform or other platforms. And when we can understand why, the why is so important in this space. The understanding that part can inform so much else. It can inform the way we do things, how we do things. But often we might skip that point. We might assume we know the why, but we don't know the why unless we ask them. And this is where it's really important.
And also, if I'm think like, for example, gambling is forbidden in many countries, so it's controlled because it's addictive. And I think the same goes, for example, like Netflix algorithms or YouTube algorithms. They try to keep you hooked on the platform for longer. But for example, in YouTube, I think they have changed the algorithm now. That in the beginning, they were just, their goal was to have as long period of watching in a single bout, and that was the algorithm's goal. And then they understood that if you keep people too long, they are unhappy, and then they don't watch anymore. So now it's about long-term watch time and not single, and they kind of try to keep people happy in some way. But of course, we can control the algorithms. There could be laws about this, and I think your studies about binge watching could inform this kind of policy as well.
Yeah, it's a science in itself, understanding the kind of the what pulls people in to watch more screen time, and it's a really, the mechanisms behind that is very interesting. And aside from the binge watching, we also found in the qualitative study that checking the smartphone for notification was an automated process, and sometimes adolescents didn't even need a notification. It was an automatic thing just to check the phone. And typically, once they did that, even if there wasn't a notification, it would lead to more prolonged use. So it's almost that, it's this innate kind of habitual process now, which it makes it incredibly hard and to change that behavior. But yeah, you're right. There are platforms now, like such as YouTube and Netflix, which they just pull you in, and they're very clever. And I think this is why it's important to connect with these organizations as well, from a partner and industry standpoint. Can we actually talk to people? Can we talk to these people and understand the use and understand the marketing strategies that are pulling them in?
Yeah. So we have talked 1 hour, but maybe a little bit more about you have a new role in Curtin University. Could you tell more about your Center for the Digital Child?
Yeah, absolutely. So the Centre for the Digital Child is a fantastic team we have in terms of trying to understand, very similar to what we've been talking about today, but understanding it in a younger child population. We've got a fantastic team, very forward thinking, using innovative measures if we talked about today, but understanding the team around the child, not just simply looking at the child alone. Understanding what influences and factors actually have an impact on their screen use. So it's a fantastic opportunity that I'm very keen to get my teeth into, and to start just collaborating with not just from a health standpoint, but start collaborating with other kind of industries, education from a more social perspective, and start looking at it from a more transdisciplinary approach. And I think this is something which we need to do more so of. We need to start asking people and working with people that have a different perspective of screen use than what we might have as health researchers. Potentially what we think is very different to what someone might think in education, to what somebody might think in a more of a connected sense, social media sense. So this is something which the centre is very keen on doing, is working interdisciplinary, and that's something which excites me. So there's a lots going on in the centre, very exciting projects happening, and I'm very keen to get involved.
Sounds great. If you're looking for any international collaboration, you can advertise advertise it here.
Absolutely, we're always on the hunt for great researchers, and I'm very aware. Being an early career researcher, I've got into a lot of literature, and there's some fantastic people that have already done some great work in this space, and I'm very keen to work with people and to really try and push, particularly the use of wearable cameras in this population, because not a lot has been done in younger children between 0 to 5 years, in the sense where direct measurement has simply not been used. So I'm really keen to work with people that have got some experience and got some just interest in using more direct measurement of screen exposure in that population.
Sounds great. So good luck with your new job. I can see from your bookshelf behind that you haven't got your books yet in the office.
Not quite. So I'm actually currently working remotely in Queensland. So I'm getting ready for the move to Perth. So it's very, very exciting time for me.
Yeah, good. So before wrapping up, do you have anything you would like to add?
I think the key thing for me is I'd like to state a question which I always get asked, and that's, are screens good or bad? And I think for me, the best answer I can give is we simply need to understand the complexity of it before we answer that question. And I don't think screens will ever be good, and I don't think screens will ever be bad. I think they will always be very complex. And the quicker we can understand that, the quicker we can really understand how we move forward and how we actually create a balance of the 21st century and the demands of using screens. And I think that's important to state. Yeah.
So basically the final remark would be it's complex. I think Stuart Biddle said the same about behavior change.
you can tell Stuart's my supervisor from a PhD, because he's had a strong influence on that. But it's true. I really think there's so many more dimensions that we need to consider before we start answering that question. So that's probably the last tickle for me. But I'm very appreciative of the opportunity to talk to you today, Ollie. Thank you.
Yeah, this was great. Thanks, George.